Hi, everyone. We are on site at the Ottawa Hospital's new campus. This site will become one of Canada's most technologically advanced research hospitals. I'm joined today by Cameron Love, President and CEO of the Ottawa Hospital, Dr. Virginia Roth, who is the Chief of Staff at the Ottawa Hospital. As we look at this site, it is a construction site, but it goes far beyond that. This is a cornerstone, pivotal part, Cam, of reshaping the future of healthcare. Can you explain why that's true?
Yeah, Tim, the three of us been part of this community and organization a long time, but I'd suggest to you that what we're doing over the next decade will reshape healthcare for the next 50 to 100 years. And there's a couple of key pieces to it. I mean, when you look at the population of Ottawa, about a million plus people, we do about 60% of all hospital-based adult care. We do 100% of everything that is complex in nature. With a growing and aging population, we need more capacity, but we need more advanced capacity. And so this campus builds that capacity for those most acute services that'll support the entire region from Barry's Bay to Hawkesbury to Cornwall and all Western Quebec. But that's only one component to this. The bigger component to it is everybody we see typically needs care before they get to us. We care for them when they're with us, but they also need a lot of care typically when they leave us. So we create an integrated care plan for patients, both when they hit or emerge, all the way post-acute care. We're also building community-based clinics and surgery clinics because the reality is particularly with the advent of innovation and lots of partnerships, we can provide a lot more care in the community. It doesn't have to be in hospital, but you need the hospital infrastructure to provide that in the community. So as we build more community clinics, as we build more surgical centers, we're building more capacity, but it's all integrated with the Ottawa Hospital campuses. So in essence, what you're building is a healthcare system, not just a site that you're providing healthcare on.
That is so exciting to see that vision for the residents of Ottawa and beyond. Dr. Roth, as a physician, someone who sees patients and cares for patients at the Ottawa Hospital, what does this mean for you?
Well, this new hospital will serve as a state-of-the-art facility where the most critically ill patients will be admitted. So this is the regional stroke center, the regional trauma center, but it'll also serve as a hub from which our teams can deploy, as Cameron mentioned, to provide world-class care really around the region, whether it's in satellite clinics, freestanding surgical centers, long-term care homes, or even in people's own homes. This will be allow for a very safe and seamless transition between the hospital and the community. I think for many patients, there's a much more convenient and comfortable place to receive care than sometimes in a hospital bed. So, for example, we're partnering with the Duke of Devonshire right now to operate 150 transitional care beds, where it's our team, our nurses, our doctors, our physiotherapists, and all of the specialists a patient might need to help them with that transition.
Cameron, just building on what Dr. Roth said, what you're describing innovation and the importance of thinking about things in a different way, perhaps differently than we ever have. Could you talk a little bit about innovation, in particular, how partnerships are critical to us achieving that vision of reshaping healthcare?
Yeah, Tim, having been part of this system now for 30 years, if I look back to when I first started, one thing that with academic centers, we are always focused on how we advance care, which is typically through either innovation or research. On the innovation side, let's take a service like surgery. You go back 30 years and you look at how we did surgery then to how we do surgery today. Many patients would have been admitted for days. Today, they could be in and out within, half hour, 2 hours, 3 hours. All of that is because of evolution of techniques, but it's also evolution of partnerships with companies that helps us either build new digital platforms, new technological devices that can completely change the trajectory of care, whether it's surgery or medicine or cancer or obstetrics. What's interesting over the last 2, 3 years since the pandemic, the pace of innovation has exploded. And so if I think what we think about today versus what it'll look 10 years from now, it'll definitively look different. And let's just take AI as an example. So we've got partnerships with some companies that use AI and digital platforms in terms of how we manage hand washing, how we manage infections, how we're performing surgery. All of that technology, what it's allowing us to do is change the value of how we provide healthcare within the organization. But to Virginia's point, it allows us to integrate and create capacity within the community, whether it's infrastructure we put into people's homes, wearable devices. It completely changes how we manage that, but you can't do it without partnerships with companies. And we have literally hundreds, if not thousands, of partnerships that are continually evolving around how do we change what we're doing to provide better care for people.
innovation, and right along with innovation is research. And there's no Ottawa hospital without research. Dr. Roth, maybe you could share how important research is, bringing that care to the bedside. So, what are your thoughts around the importance of research at the Ottawa Hospital?
So really, without research, we could not deliver world-class care. It really is integral to everything that we do. I think of this very site that we're standing on right now, which will become one of the most innovative neuroscience research centers in the world. And that then allows us to attract and recruit the top minds to help us deliver on our commitment to continue to find new and better ways to help our patients. For some patients and families, they've exhausted all options, and research really can bring renewed hope right here in Ottawa.
Cameron, you mentioned partnerships with the community. You mentioned working with industry, et cetera. You know, Here we are. It's an exciting time. We were here a year ago introducing this site to the community. What would be your message to the community at this moment in time at the Ottawa Hospital?
Yeah, Tim, I think we're starting from a place of strength. We've always had a really great organization, great healthcare system in Ottawa, but we have to evolve. We've got, as I said before, we've got an aging population, but we also probably have one of the greatest opportunities to truly reshape healthcare between building this new campus, plus the support we're getting out of governments to build more infrastructure, coupled with an incredible digital platform. The ability for us to build a world-class future healthcare system over the next decade is probably greater than it's ever been, which quite honestly is not about us. It's about the generations to come of what happens 10, 15, 20, 50, 100 years from now. And so it really is a starting place to build the future of healthcare.
Here we are on the site, and we've talked about construction, but it is about reshaping healthcare. And when I think about the Ottawa Hospital Foundation, I think about the importance that philanthropy plays in helping the hospital achieve this mission. The $500 million campaign to create tomorrow is a critical part of this plan. We're grateful to the community to date, but our ask to you is to be involved. Our ask to you is to join us.